Welcome to Lesson 4.3, Understanding and Following Client Care Plans. Every client is different. They have different abilities, routines, preferences, risks, and care needs. The client care plan helps care partners understand how assigned services should be provided safely and consistently. Before providing care, you should know what the client's current care plan requires. In this lesson, we will discuss what information may be included in a care plan, how to follow it, and what to do when the client's needs appear to change. A client care plan provides important information about the care and services the client is scheduled to receive. It is individualized to the client. The plan may explain what assistance is needed, how frequently certain services should occur, safety precautions, client preferences, and other instructions relevant to care. Care partners should never assume that every client receives the same services. Always follow the current care plan and agency instructions for the specific client you are serving. The care plan creates consistency. A client may receive services from several different care partners throughout the week. Without an established plan, each person might provide care differently. The care plan gives the team a common guide. It also helps prevent care partners from performing tasks that are not authorized or providing assistance in a way that conflicts with established safety precautions. Before providing services, make sure you understand the client's current care plan, even if you have cared for the client many times before. Do not assume nothing has changed. Care plans can be updated when a client's needs change. You should know what tasks you are assigned, what assistance the client requires, and whether there are specific precautions or instructions. When you are unsure about an instruction, contact your supervisor rather than guessing. Activities of daily living are commonly included in home care plans. The care plan may identify which activities the client can perform independently and which require assistance. Encourage appropriate independence whenever possible. Do not automatically perform every task for the client simply because you are there to help. Provide the level of assistance identified by the plan while respecting the client's abilities, choices, dignity, and safety. Mobility instructions are especially important because improper assistance can result in serious injury to both the client and care partner. The care plan may identify the client's normal level of assistance and any approved mobility devices or transfer procedures. Follow those instructions. If a transfer appears unsafe or the client suddenly requires significantly more assistance than indicated in the care plan, do not simply improvise. Protect the client from immediate danger and contact your supervisor for guidance according to agency procedures. Care plans may contain important instructions related to meals and hydration. A client may have specific food preferences or dietary instructions. Care partners should follow the documented plan and should not independently change prescribed or established dietary instructions. If a client refuses a meal, requests something that conflicts with documented instructions, or experiences a significant change in eating or drinking, follow agency procedures for reporting and documentation. Medication responsibilities must be handled carefully. Non-medical care partners should follow their authorized role, the client's care plan, and agency policy. If your assigned responsibility is to provide a medication reminder, then provide and document the reminder according to the established plan. Do not independently change medication instructions, recommend doses, or make medical decisions for the client. If there is a medication-related concern, report it through the appropriate agency process. A care plan is not simply a checklist of tasks. Quality home care should also be person-centered. Clients have preferences about how they live their lives. One client may prefer bathing in the morning, while another prefers later in the day. One may enjoy conversation, while another values quiet time. Follow documented preferences whenever they can be safely accommodated within the care plan and your assigned responsibilities. Care plans may identify risks that require specific safety precautions. For example, a client may have an increased fall risk or require supervision because of cognitive impairment. These instructions must be taken seriously. Do not ignore precautions because the client appears fine that day, or because following them may take additional time. The precautions exist to help reduce known risks. Care partners must stay within their assigned role. A client or family member may occasionally ask you to perform something that is not included in your assigned duties. Do not assume that every request is automatically authorized. If you are unsure whether you can perform a requested task, contact your supervisor. Never independently rewrite or change the client's care plan. Clients and family members may request additional assistance during a shift. Many requests may be reasonable, but care partners still need to remain within their authorized responsibilities. If the request is unfamiliar, outside the established care plan, potentially unsafe, or something you are unsure about, contact your supervisor before proceeding. Do not allow pressure or embarrassment to cause you to perform a task you are not authorized or trained to perform. A service being listed in the care plan does not mean that a client loses the right to make choices. Clients may refuse care. If that occurs, remain professional and respectful. Do not force the client to participate. When appropriate, explain the assistance being offered and try again later if permitted. Document the refusal and notify your supervisor according to agency procedures, especially when the refusal could affect the client's health or safety. Care plans describe the client's established care needs, but clients can change. Suppose the care plan indicates that a client normally needs minimal walking assistance, but today, the client cannot safely stand without significant help. That difference matters. Do not simply assume the care plan is wrong and create your own new procedure. Document what you observed and report the change promptly so the appropriate person can determine what action is needed. Care partners play an important role in identifying changes because you spend direct time with clients. However, observing a change does not mean you independently change the formal care plan. Your responsibility is to observe what is happening, report relevant changes, and accurately document them. The appropriate authorized person can then evaluate whether changes to the client's plan are necessary. It is important to understand the relationship between the care plan and your daily documentation. The care plan tells you what services and assistance are planned. Your daily note records what actually occurred. If everything happened according to plan, document the care provided. If something did not happen according to plan, such as a refusal or change in the client's condition, document why and follow appropriate reporting procedures. Consider this scenario. The client's care plan indicates that they normally walk with a walker and require minimal assistance. Today, however, the client is unable to stand safely without significantly more help. Should you simply attempt the usual routine? No. This represents a change from the established care plan. Protect the client from immediate danger, follow applicable agency procedures, notify your supervisor, and document your observations. Now consider another common situation. A family member asks you to perform a task that is not included in your assigned duties. Even if the family member says another care partner normally does it, do not automatically proceed. Verify that the task is appropriate and authorized. Contact your supervisor for guidance. This protects the client, you, and the agency. Before providing care, make sure you understand what is expected. Review the client's current instructions. Know what assistance is required. Pay attention to safety precautions. Understand what services are assigned to you. If something does not make sense or appears different from what you observe, contact your supervisor. Guessing is never the appropriate solution when client safety is involved. The client care plan is one of the most important guides you will use as a care partner. Know the plan before providing care. Follow assigned services and safety precautions. Respect the client's choices and preferences. Pay attention when the client's abilities or condition appear different from what is documented. And remember your responsibility when something changes. Observe, report, and document.